Rebecca, I'd love to hear more about you and kind of you as a professional and just kind of what led you to Compass.
Yeah, absolutely. So I'm a licensed clinical social worker. I've been in the behavioral health field for a little over 10 years now, both licensed and pre-licensed. Got my start in crisis intervention, worked on an ACT team, I worked at a suicide hotline. And those experiences really were incredibly valuable to me, not only in teaching me very important skills, but also kind of shedding light on just how much need there is in the community, especially for folks with more serious mental illness. After those experiences, I got my master's degree and was able to practice clinical therapy. I decided that I wanted to continue working with folks who are a little bit higher acuity. So I had the opportunity to work at some IOPs, some PHPs for both mental health and substance use. The fact that people are able to come to you and trust you at the lowest points of their life is just really incredible of that level of care because we tend to see a lot of progress in a short period of time and it's really miraculous to witness. I did a short little stint in outpatient therapy. It was a really great experience. Again, a wonderful learning opportunity, but decided that I missed the higher acuity level of care. I had the opportunity to interview with Compass and I was really impressed by just how um, structured everything is. The curriculum is all evidence based, which is something that's really important to me. And also just felt like with our KPIs and the fact that we're a data driven organization, knowing that we have evidence that this level of care and our treatment works was also something that was really important to me. So being able to be in the associate director role where I would have the opportunity to help coach some of our group therapists and some of our other clinical staff to be able to provide the best services possible was just, really special and important to me.
What is it about the young adult and adult population that interests you? Why did you decide to focus in on that age group?
I think especially with young adults, I think that is a very unique time in somebody's life where they're still kind of working on identity formation, kind of transitioning out of that adolescence where forming identity is kind of the main goal. So they're still working through that and then having to transition into some of those more adulting tasks and figuring out how to really function in society. And is a very unique time where people tend to struggle a lot. I just saw a really great need for care there. And with the adult population as well, I think there's kind of this sense that people are supposed to have it all figured out by the time they're a certain age or they're an adult. And so being able to help destigmatize like mental health concerns or substance use can come up at any point in the lifespan, I think is a really important thing.
Yeah. And if we want to kind of shift into, for this specific population, this conversation around mood and anxiety disorders specifically, how do those types of challenges and those types of disorders that someone could be experiencing, how do those symptoms extend beyond the surface and into a person's identity, feelings of self-worth, their self-esteem?
It's, pretty common for adults, young adults who are experiencing depression or anxiety or other mood related mental illness for their identity to change in some ways as they're struggling with those symptoms. And there's a lot of different reasons for that. Anxiety or depression really shift how we view the world. They shift our perception of the world. And that
Mm.
includes our self concept. So when we're falling into patterns of thinking that we often see with anxiety and depression. It's going to change how we see the world around us. It's going to change how we see other people in our lives. And it's also going to change how we think and view ourselves. And a lot of times that looks like our internal narrative being a lot harsher and also more rigid. We're less likely to take in information that goes against our beliefs about ourselves or the world or the people around us. And then all of those changes to our self-esteem become very cyclical, where the depressive symptoms are reinforcing those beliefs about ourselves. It's very easy for that to become a place where somebody can get stuck and feeling really poorly about themselves.
And I can imagine if you're struggling with, like you said, a type of mood disorder and anxiety disorder, you probably don't notice that shift happening. Would you say that is kind of accurate? That without being able to see that their sense of self has been diminished when they're coming in for help, maybe that isn't something that is completely apparent to them?
Yeah, I mean, it's certainly going to depend on the person, but I think in general, it is pretty common for these thought patterns or change to self esteem or self identity to go unnoticed. A lot of the changes that happen in thought processes and in mood show up in in what we call automatic thoughts, right? So these are thoughts
Right.
that we're not necessarily trying to have or conjure up. It's just sort of the background noise that's constantly running in our head. Oftentimes, we're not even really consciously aware that our narratives about ourselves have shifted until
Mm,
maybe one day we wake up and we're like, wow, I feel really terrible about myself. How did I
yeah.
get here?
Yeah. And what is happening psychologically that causes people to see themselves more negatively?
Yeah, so there's a couple of different things that are going on. One of the big things is that our brain naturally has kind of evolved to be threat focused. So we're kind of constantly on the lookout for danger or what we might perceive as things that are threatening. And in the past, so this is something that has helped us survive as a species. But also, especially if we are maybe more prone to anxiety, that does leave us vulnerable to misattributing harmless stimuli in our environments as potential threat. And a lot of times in our current society, what that looks like is viewing social situations as threatening, which is maybe where some of that social anxiety can come in, or even labeling some of our own behaviors as potentially threatening to relationships. And as humans, we are social creatures. Forming relationships is one of the main things that we do as humans. So when we see ourselves as being a threat to our ability to connect socially, we tend to get really, really hard on ourselves so that we aren't making those same, what might be perceived as mistakes. With that, we also tend to be a little bit more hardwired to prioritize or focus on negative experiences. So I always use the example of if I'm, one of my ancestors, I don't need to remember or keep track of the 20 bushes that are safe. I just need to remember the one bush where that tiger jumped out at me that one time. Our brain is hardwired to remember those things that we perceive as threats or that feel dangerous or give us anxiety, which leads to us then perseverating or ruminating on those things. And so if we are seeing our own actions or behaviors or traits as bad or threatening in some way, and we start to ruminate on that, that is just going to further reinforce those beliefs we have about ourselves.
Is this an inner critic almost, or what's the line? I guess because we all have the inner critic, right? Like you said, it's an evolutionary trait that we all have. What's kind of the line where it becomes a barrier and it starts really impacting someone's sense of self?
Yeah, that's a great question. Like you said, we all have an inner critic and it does have that evolutionary function. I think where it crosses that line into potentially having negative outcomes on our lives and how we feel about ourselves is when we're not able to differentiate between what is a fact and what is a feeling or what is based in reality and what is just a thought. A lot of us maybe do have that inner critic and we're able to kind of take a step back and say, okay, maybe I'm being really harsh on myself. Or when we're really stuck in that place of anxiety and depression, our self-concept becomes so rigid that we're really believing all of those things that the inner critic says. And we're not as open to seeing or noticing evidence that might go against some of those thoughts we have about ourselves.
How does this kind of differ between kids and teens, young adults, adults, if it does?
Mhm.
Um, I'd love to kind of hear from you on that.
Yeah. So anxiety and depression and the effects on self esteem look different in different age ranges and populations. In kids, that tends to look more like behavior based labeling, defining kind of their identity or sense of worth on maybe a single event. So let's say I'm a child and I was mean to a friend at school and I feel bad. I know that was a bad thing to do. Instead of being able to say, okay, I did a bad thing, it kind of becomes I am a bad person. That of course has implications on how they see themselves moving forward. For teenagers, that is really when we start to form a solid sense of self or identity. And so when teenagers are experiencing anxiety or depression and that kind of changes their perspective on themselves, ultimately that can look like having a lot of self-doubt or not really having a strong sense of self, which can then also kind of look like conforming to peer pressure or difficulty setting goals for the future. For young adults, as I was mentioning earlier, that's kind of the stage in life where we're still working on really forming a solid identity, and we're also navigating kind of starting work or maybe higher education or whatever that looks like for the individual. And so that's when we tend to see a lot of comparing out. So young adults might be looking at other people in their age range and saying, okay, well, why am I not performing as well as they are? Why am I not where they are in their career? Again, that's going to kind of reinforce some of that negative self talk or negative beliefs about the self. In adults, it's generally going to look like a lack of confidence and sometimes could even potentially look like feeling like we lack a purpose, or feeling like we're not really competent or good at something. We don't really know what our strengths are and how to utilize them in a way that feels meaningful.
And how can all these feelings and thoughts that someone's experiencing make it harder for them to seek or engage in treatment?
I think the big thing is after a while of having that really negative self talk and those negative beliefs about yourself being reinforced, what we see, unfortunately, a lot of times is that people feel like they are in some way undeserving of help. That might sound like my problems aren't big enough or bad enough that I need help or I don't deserve to feel better about myself. And there can also be a hopelessness about the ability to change when you've had this negative sense of self for so long and it's really rigid and not open to being challenged. It can be really easy to get stuck in that place of these things that I'm thinking about myself are true and there's no hope of that changing. I think for a lot of folks there's also that fear of being judged. When you have a really harsh inner critic already, you kind of make the automatic assumption that other people are thinking about you the same way that you're thinking about yourself. And that can be really disheartening when you're thinking about, especially going into group space.
What would you say to someone who's having these feelings, whether they're trying to decide whether they should seek treatment or they're having trouble engaging in the treatment that they're in? What would you say to them?
The main thing I would say is that we have evidence that suggests that it is possible to change our inner critic or our relationship with ourselves. We as humans have what's called neuroplasticity, which is basically the brain's ability to adapt and change throughout our lifespan. And so both on an emotional level and on a neuroscience or brain level, we do know that it is possible for our relationship with ourselves to change. And I will be the first to admit that going to a program or getting help can feel really scary. And from what I've seen, a lot of people tend to have really good experiences and do learn a lot of things about themselves and are able to make connections with others and learn skills that help them manage some of those feelings of anxiety and depression. The number one thing I would say is that there's no harm in trying and that we are all deserving of love and care from others, but also deserving of love and care for ourselves.
Yeah, absolutely. And when someone is engaging in treatment, what aspects of self esteem specifically and self worth, self image tend to start to shift?
Typically, the more somebody engages in treatment, the more that we're seeing that our sense of self or our identity becomes a little bit more flexible. So we're able to not only shift some of the negative self-talk and challenge some of the harsh things our inner critic are saying, but we're also seeing that folks are better able to recognize and accept the fact that we are complex and dynamic. We can hold multiple truths about ourselves at once, and with the ability to be less judgmental, to say, okay, this is who I am and that's neither a good nor bad thing, it just is. And the other thing I think we tend to see a lot of is that after they're maybe leaving programming or have gotten some help to manage the symptoms of anxiety and depression, they feel more confident in their ability to do hard things and to tolerate discomfort. Whereas before, when we're really in the midst of those depressive and anxiety related symptoms, it's really easy to tell ourselves, I can't do that. And so a big thing that we see is a willingness to try and a willingness to do things that maybe otherwise we would avoid because they felt really scary.
And what are some specific coping skills, some specific skills that we teach at Compass that help them relate to themselves differently?
This is something I could talk about for ages and ages. I'm a big believer in the skills. I think there are quite a few. I'll try to choose the main ones. So any of our skills that are going to be related to challenging and reframing our thoughts, we all experience what are called cognitive distortions, which are essentially thinking errors or traps that we fall into. And we're especially prone to believing those cognitive distortions when we're experiencing anxiety or depression, again, because they kind of reinforce either how we feel or how we're thinking about ourselves. Cognitive reframing is one of the skills that we teach at Compass that teaches people how to catch those errors in thinking and check the facts, or kind of decide, okay, is this a fact or a feeling? And how can I reframe this thought that I'm having to be something that is more evidence based or more neutral rather than overly negative? With that, there's also thought diffusion, which is rather than trying to change the thought themselves, it's trying to change how we relate to our thoughts. So the idea behind cognitive diffusion is that we can recognize that our thoughts are just thoughts. That doesn't mean that they're necessarily true. And also that we can have those thoughts, that they can exist in our minds without us having to engage in them or allow them to change how we feel about ourselves. Some of the other things that I think are really, really important would be identifying values and talking about value based actions. Values are a huge part of our self identity and also a part of our identity that we don't spend a lot of time thinking about. So, really being able to sit down and identify, okay, here are my values, here's what's important to me in life, can then help us sit with or work through if one of my values is connection, but I have social anxiety, I've probably been avoiding social circumstances because of the anxiety. And when we focus on value based actions, it allows us to say, okay, I'm going to sit with the discomfort of this anxiety in service of this value, because that is what I want my life to be filled with is connection. And then the last kind of broad category of coping skills that we teach at Compass that I think are hugely helpful are emotion regulation skills. And so these are skills that are really meant to help us identify and label what exactly it is that we're feeling, because sometimes we know we're feeling something, but we can't quite put our finger on what it is. So our emotion regulation skills help us put labels on what we're feeling and then help us manage those feelings in a way that, isn't avoidance based, and it really focuses on, again, kind of doing things that are in line with our values without our feelings overtaking us.
Could you provide an example of one of those emotional regulation skills?
Yeah, absolutely. A lot of our emotion regulation skills are going to involve some sort of mindfulness. So, one emotion regulation skill that I think is really valuable is a body scan, or sometimes taking the next step into progressive muscle relaxation. But that skill is essentially sitting down and really scanning your body and really sort of noticing what's happening physically and emotionally in each part of your body to gain a greater awareness of what you're feeling, and what might be helpful in tolerating or changing those feelings.
Right. I think that will be helpful for people to hear. I'm curious, how does group therapy specifically help with building these skills, but also rebuilding that sense of self-worth, being around other people experiencing similar feelings, even if their stories aren't the same, right? Like just being in that space. I'd love to hear your thoughts on group therapy and how that's impactful.
There are a lot of really awesome things about group therapy. And one of those things being that it does provide a space for people to hear that they are not alone in what they're experiencing, especially when we do have that anxiety or depression, or maybe that negative self talk that is changing how we view ourselves. It's, not uncommon for people to feel like I'm the only one that feels this way, or I'm the only one having this struggle. And so being able to connect with others who are experiencing something similar is really, really helpful and can automatically start to change that perception. It also provides folks with an opportunity to provide feedback to other people, or to show or prove to themselves that they have valuable things to share, to valuable experiences for others. It gives us that sense of altruism of, okay, I am able to help somebody else. And additionally, the group space is really wonderful because it is providing an opportunity for patients to practice skills daily, both in structured ways of like a group therapist saying, all right, today we're all going to work on this specific skill, and in more informal ways of, okay, if I'm somebody struggling with social anxiety, I'm in a group of people, and now I can use my skills to help me connect with others or to feel more comfortable talking in front of a group. So it's really kind of direct exposure to some of those things that might feel anxiety inducing for some people.
I'm sure sometimes you hear from folks that they're apprehensive about the group therapy experience. What would you kind of say to them?
I would say that I think it definitely can sound intimidating when you're thinking about walking to a group of other people. But everybody who's in that group is there for the same reason. Maybe not the same specifics, but they're all there to feel better and to work on themselves to learn the skills. We do tend to find that it is a very open-minded and welcoming place because we all have that common goal of, wanting everybody to feel their best or live their best lives. Something I'll say to patients on their first day is, we're not expecting you to come into the group and answer every question and stand up and pour your heart out in front of everybody. It's okay to take time and to acclimate. And, nobody's expecting you to share anything groundbreaking or make any huge strides in front of the group.
And I'm curious if someone is specifically struggling with anxiety or depression or a mood disorder, when would you say their symptoms signal that a higher level of care is generally needed and they should consider the option or reach out to kind of ask those questions?
I would say anytime that somebody is experiencing chronic thoughts or consistent thoughts about harming themselves or potentially harming other people as a result of depressive symptoms, that would definitely be a point where I would encourage folks to talk to their current providers about exploring a higher level of care. Outside of, those more immediate safety concerns, I think if people are seeing that their anxiety or depression symptoms are really impacting their ability to live the life that they want to live, that sometimes looks like difficulty getting out of bed and taking care of our activities of daily living, like showering, brushing teeth, eating, or if somebody is depressed or anxious to the point where they're not able to go to work consistently or care for their children or pets or parents or whomever, those would definitely be signals that somebody might need a little bit more support than what they're currently getting.
And kind of along those same lines, you hear the terms like high functioning anxiety or high functioning disorders. Is that something that could kind of mask what's going on in the severity of someone's symptoms? And could you speak to that a little bit?
So there are a lot of people out there who struggle with anxiety, depression, and are still able to get up and go to work every day. Maybe from the outside looking in, we wouldn't necessarily recognize that they're struggling. I think for those folks, looking at or examining, one, is this something that I'm able to continue doing? How feasible is it for me to continue living in the way I'm living long term? I would, y- you know, say, kind of going back to that idea of values. Maybe I'm able to do the things I have to do, but am I able to find pleasure and enjoyment in my life? Is this the life that I dreamed I would be having maybe when I was a kid or whatever? And if not, if it feels like just sort of going through the motions and not able to enjoy my life because of my symptoms of anxiety and depression, even if other people might not be able to see that from the outside, I think that would also be a good indicator that somebody might need a little bit more support.
And along those lines, if you could leave readers with one message about self esteem and mental health and kind of how they're related, what would it be? What's the big takeaway that you would want to leave people with?
I think the big takeaway would be that anxiety and depression really change the way we view ourselves and the world around us, by way of changing our perspective, changing how we are viewing and interpreting the world around us. And if there's one thing that I hope folks take away from this interview and from our programming, would be that not everything you think is true, and not all feelings are facts. It is important to be able to question what we're thinking about ourselves and recognize that not everything we think about ourselves or towards ourselves is 100% accurate.
Yeah, I think that's huge. And I think sometimes it's so easy to forget that. If you're having a thought, you're like, oh, I must feel this way or this must be true. And then we can start spiraling out of control almost. And I think that's such an important thing to remind people of. Is there anything that we haven't touched on in this conversation that you think is really important?
No, I don't think so. I would just reiterate, if depression or anxiety or mood disorder is something that somebody's struggling with, that they're not alone and change is possible. It takes a lot of bravery to get help and a lot of tenacity to stick with it. And taking that step is a really huge and wonderful thing.